Okay, good morning, everybody. Thanks for joining us today. I think we have a great topic and a wonderful person with experience. You're going to meet Teresa Youngstrom, who has many years of experience with dementia and personal experience caring for her mother. She works a lot with the Alzheimer's Association, so I think she's going to have some good clinical, behavioral interventions for us in this difficult time. And I look forward to this lecture. So welcome, Teresa.
Thanks so much for having me here. This is a pleasure. I've been looking forward to it for a month, so I'm very excited to be here. I'm going to go ahead because we have only so much time. I know 40 minutes sounds like a long time to some of you, but boy, can I talk about dementia and just it's become my thing. So I'm going to go ahead and bring up the PowerPoint so we can get started. Okay. So my company's called A Better Approach to Memory Care, and I didn't know this is what I was going to be doing. I'd been a nurse for a long time. It's getting close to that 40-year mark. I can't even believe that, but I've done a lot of things. And my first stomping ground was down at UC because I figured that's where you need to go to really know the, cutting edge of what's going on. So spent time in high risk L&D down there and then did their ER. Scared to death at first, but you know what? I loved it and I learned so much. And then my career went on with a lot of more. I did more ER, more agency, did a lot of agency while raising my kids. And you know what? Eventually helped with a private duty company and became a director of a memory care and assisted living. I guess there was a part of me wanted to see the inside of what that was about. And then my mom started having symptoms of dementia. So I was like, "Uh-oh, we gotta we gotta do something here and change what's going on." Because here's this old nurse, and I got to tell you guys, I thought as an old nurse I could handle that. You just be nice to them, right? That's what you do. And I was so wrong. And I got to tell you that my sweet mama, as her disease progressed, she couldn't see her disease. And we're going to talk about why. I didn't understand that at all. And I can tell you, she threw me out of the blankety blank house, and it wasn't pretty. It was blankety blank, you get out of my blankety blank house. And I thought, what just happened? And I left a big job to decide I was going to figure this out because I had to learn how to take care of her. Um, and I knew that people were struggling doing this. And so I went to North Carolina to study with a lady named Teepa Snow. I don't know if any of you have heard of her. She's now internationally known, TEEPASNOW, positive approach to care. And she has some wonderful techniques. She's an old OT, like I'm an old nurse, and she's just a couple years ahead of me. But I brought those techniques home and was amazed at how well they worked working with my mom. And she gave me some great insight. And then it was really laid on my heart. Wow, if a nurse of 30 plus years had this much trouble with all my background, my clinical background, and thinking I was so smart, wrong. Uh, then probably there are a lot of families struggling with this. And that's when I started my company, A Better Approach to Memory Care. And so we do consultations, we do phone, we do Zoom, we do in person if you live around Cincinnati area. But I get to do that. I'm podcasting now, Memory Care with Teresa Youngstrom, and just doing everything we can to try and get more information out, staff training videos, and the list goes on. But today I'm here with you all. And we're going to talk about confidence instead of chaos with dementia. Dementia and Parkinson's, in my experience, and of course, I ran into Maureen actually through Parkinson's Community Fitness over in Blue Ash area, and I had been teaching there. And probably 50% of the people, and I'm not telling you guys anything you don't know, do develop some dementia. And it's under that heading of dementia. And so it's good to figure it out, know the symptoms, and know how to come alongside and love these people through this. You cannot finger wag and chastise people into submission. Now, sometimes they get medicated into submission, but I'm here to try and work with that and see what we can do to come alongside and train us. Because honestly, before we get started, if someone has to change the way they do things, and there's two people, and one of them's memory isn't working very well, who has to change the way they do things? And guys, it has to be us. And that's what I needed to accept and agree to when helping to care for my mom. And then had to start training up my family in better ways and all the caregivers of better ways to do it. We do sell a staff training video too. So, just to get started, I think to point out something very obvious. Here's a woman. I want you to look at this woman and tell me what's going on. Can you see the disease? Can you see
No.
what's going on here? I mean, and this is the biggest challenging part with dementia is it doesn't always stand out like a broken arm or like even when you're having a stroke or some type of a, palsy or something, or maybe a tremor, something like that. It doesn't stand out so well, doesn't it? This is my sweet mama. And I can just tell you, you push the wrong buttons and she's going to be coming after you and verbally. And it could be really tough. And so I like to put this up there just to have us start thinking about the people we're loving with Parkinson's and what to look for when it comes to dementia. Because they may develop this, and they may not. Parkinson's is such a different disease because, with most dementias, the symptoms start with, memory loss and things like that. And we'll talk about that. And with Parkinson's, it's usually a physical challenge that they're having. Not always, because Parkinson's, we are so on the cutting edge of learning more about Parkinson's and how it relates, how the dementia relates, and how it relates to Lewy body. And I know some of you have probably been exposed to that because, Alzheimer's is still the most common type of memory challenge, a type diagnosis of dementia we see out there. But I got to tell you, this Lewy body Parkinson thing is really on the grow. And the hard thing is, there's not an easy test to test for it. And that's, I think, what is so challenging. And so we can get misdiagnosed on a lot of this, but we're working it. And there's lots of research going on and lots of medicines in the works that we're trying to get to help stop some of these diagnoses. But there are more than 120 diagnoses that can give you symptoms of dementia. We've talked about a couple. So that's why it's so important to know what's coming down the pike. Let's look at some of the symptoms you might be, familiar with, because maybe what do you already know? So we talk about memory loss and, think to yourself, is it really short term or long term? It's usually short term that we see mostly, not always, but in most cases, it's short term memory. The hippocampus in there, it gets damaged. The hippocampus is the place where thoughts should come in. It should be sticky in layman's terms, right? And then at night when we sleep, the information in the short term should go to the long term and be secured there. And maybe for most of you, that works just great. But when a dementia comes in, a lot of times that's the first sign we see is short-term memory loss. And it might look like them asking you again and again. It might be that, whatever they did this morning, they have no clue that they did that. I know my mom was good in the moment. She had more of a vascular dementia. She had a cardiomegaly. She had some stroke symptoms. And so in the moment, she could carry on a good conversation. It was amazing, but no short term. So don't say, but don't you remember? Those are those are no words in my world. We never say, do you remember? Why can't you remember? I already told, oh yeah, no, I'm not going to let you get away with those words anymore because it's not fair. It's a broken brain. It's like telling the guy with the new hip replacement to take the steps. You did it last week. It's crazy that we would treat someone like that has a terrible, brain failure type disease. So memory loss, getting lost. You might know someone who drove their car and, either ran it out of gas. I had a client that did that. We were so close to getting him to the doctor. The son had finally stepped up, made the appointment for a Monday. And on Thursday, don't you know, his dad got a wild hair and they found him in Indiana on the interstate. I guess fortunate or unfortunate, I guess that he didn't get any further. It was Indianapolis and he was in the center lane of the interstate. Fortunately, the police officer had some good training and he knew what to do in order to get the information he needed to get him back here so then we could get him some help. He definitely jump started the help though. He went straight to getting help where we thought we were going to be able to rule out some things that could be dementia that aren't necessarily. We'll cover that. But yeah, he really catapulted the the care for him. It was a happy ending though, I got to tell you. So anxiety, depression, hallucination. So Lewy body definitely has trouble with hallucination. We can have hallucination though from medication problems. Anxiety, depression are technically though treatable, guys, because falls under the mental health. So technically treatable, but when we get a mixed picture like this, and maybe someone's capacity, that maybe their cognition, language and cognition is at a point where they can't even really describe to us how they're feeling or what's going on. They may not be able to tell the doctor anymore what's going on. They might just holler out a cuss word, right? I call those emergency words. What? I know. I call them emergency words because when language and cognition gets damaged with a lot of these dementias, frequently all they have left, especially if they're being pressured or if they're uncomfortable, pain, fear, anxiety, might just be the emergency words. My mom had her favorites. All right. The initials were G and D. Okay. And she used it whenever she was upset. And it wasn't like my Catholic mama to use these words, but we knew not to react, not to scold. We knew that there was pain, fear, anxiety going on. We needed to be great detectives and see if we could do a head to toe and figure out what had happened that all of a sudden had her upset. People don't get dementia overnight. Something overnight is probably more likely a gallbladder attack, a migraine, a UTI, appendicitis. It's something else. Um, Dementia doesn't come on overnight. Usually we'll diagnose it, once we do the testing, we'll figure out it's something else. And anything else that causes symptoms of dementia that's treatable, guess what? That's not a real dementia. Might be delusional for a short time, but that's not a real dementia. Okay. All right. Unable to perform simple tasks anymore. Grandma could always make that apple pie, do that crust. It was so good, but just she knew it like the back of her hand. And then all of a sudden that apple pie didn't start tasting so good anymore. We knew there was a problem. Okay. So sometimes people struggle with the order of things or they just can't initiate. I had a client once, lived over in Terrace Park, really nice home. Her son was all connected and bringing her food, and he even had the food plated in the fridge. All she had to do was open the fridge and get it out. And guess what? That was the step that was missing. She could not initiate opening up the fridge to get to the food. When I went to visit, boy, she was getting pretty thin too. I just opened up the fridge. I didn't even ask her if she was hungry. I thought, oh, this looks good. This looks good. This looks good. And I just put it out in front of her and she ate ravenously. So it was definitely time for her to have help come in or go to a place where she could get help. But sometimes families, they need to reach that point. I'm always promoting, always know your plan B. Always know your plan B with these type of, um, you know, disorders. You need to know your plan B because you may get to a point where you can no longer keep your loved one at home. And I don't want it to happen suddenly to you, or I don't want something to happen to you if you're the caregiver. If you have a medical emergency, then what happens to your spouse or your loved one or your mom or whoever it is you're caring for? So, guys, be sure and research your plan B. And if you want to get on a waiting list at some of the better places, do it. Do it. But know what goes into that, know what it's going to cost, know what you need to do, have your ducks in a row. Oh, and I'll mention on the side, powers of attorney, living wills, advanced directives, very, very important. Have those updated and notarized, okay? And copies. So if they do have to go to the emergency room or something, you've got the paperwork ready to go. Okay, confusion has the evening hours. Now you guys know what we call this. Yep, sundowning. You hear that. And I studied this, I studied sundowning and really came up with a tired brain. And although their brains are on decline, the tired brain seems more significant for them than for us. But I got to tell you, I wouldn't be as good doing this talk at 11 p.m. as we are at 11 a.m. All right. I would have a tired brain. I maybe wouldn't be as patient or be able to think as clearly, maybe wouldn't be able to remember things. And I'm hoping my brain's okay. But guess what? It's normal aging. And it's just these bodies. We get tired. We need our sleep. And so it will take more time, energy, maybe, and more patience in the evening, and maybe it's time to implement a nap. When my mom started getting more and more irritable in the evening, we put a nap into her routine. We started putting her down for a nap at 2 o'clock in the afternoon. And you know what? It helped a lot. The other thing is that people that have dementias, as I'm sure you know, people with Parkinson's, don't rush them. Don't rush them. You can't do it. It's not going to work well. It's not going to end well. Okay. So let's not do that. We had to take an hour to get her ready for bed. So declining social skills or social interactions, and I know you see this with Parkinson's too, especially if they have where they can't give much facial expression, maybe they can't even find their words right now. You know, it all depends on what's going on in the brain and where the decline is happening as to what these symptoms look like and how we need to come alongside and join them on their journey. Can we instruct them on how to do better and come up and be what we want them to be? Nope. Is it possible that we'll grieve the loss and the dreams of what we thought we were going to do? Yeah. I mean, my dad, he traveled with my mom for a while. They had this wonderful motorhome that he had purchased for them to travel. And it was good for a while because it kept her in a very safe environment, a very same environment. She and the dog and him, and he did all the driving and navigating. So it was really a good thing for a while. But then she had trouble getting up in and out of it with her knees. Um, and then the knee replacement, the anesthesia, I tell you, I'm not the expert. I'm not the doctor on what anesthesia does to our brains, especially these older brains and brains that have decline. But it really catapulted her dementia in a lot of ways. And honestly, you know what, guys? When it came time to do therapy, like if you have a joint replacement, can we all agree that you have to do therapy? Yeah. So guess what? That hurt. And in her broken brain, no logic. What's that? Yes. Some of these individuals lose logic. So she couldn't connect those dots that you could take some medicine ahead of time. It could be uncomfortable, but you got to press through the discomfort in order to see good results. She couldn't get through that. All she could see is uncomfortable, no, stop, not doing it. Yikes. Okay. She never walked again. She walked a little bit after that knee replacement, but as soon as she declined a little bit with the knee, then she would not do therapy again. So wheelchair bound then the rest of her life. Just saying. Okay, how about defensive, never wrong, always the victim? Any of you see this in folks that you know that are struggling with some type of a dementia? It can happen. Sometimes, sometimes we see paranoia and suspicion, and they seem to never be wrong, always right. We're always wrong. It's always your fault. And it's tough. Well, guess what? There's a reason. I'm going to talk about a diagnosis as to why they did this. And how come I'd been a nurse, more than 3 decades and I didn't know about this? But we're going to talk about it. All right. Anosognosia. We'll talk about that, why they act like this and how we can come up with a new care plan to love them along. And it has nothing to do with Haldol or any antipsychotics. Okay. Wandering, trouble sleeping. Some folks do deal with that. I have a woman right now. She's still in her home, but she won't be there much longer. It's getting really hard. And she's been exit seeking, meaning she, for some reason, gets a wild idea that she used to help at the school. And she gets a wild idea in her head that she's supposed to be at the school. Oh, my word, I'm supposed to be at the school. And so she's looking for every door to get out of the house because in her mind, one track mind, she needs to get out of the house and she needs to go up to the school. And so it's getting really hard on the husband keeping track of where she is. She's still ambulatory. She still walks. And in her mind, she thinks she's supposed to be somewhere else. And you just have to have skills on how to come alongside and love them through that. Oh, you need to go to the school. Oh, okay. Well, you know what? Maybe I can take you. And what I want you to do is learn to validate their position when they're ticked off about something that you don't seem to understand. You need to accept and agree. We're going to talk about those tools. How do we accept and agree? You're like, what do you mean accept and agree? They're wrong. I'm telling you, it's brain failure and it's time to learn to accept and agree. Okay. If their brain is not allowing them to comprehend the reality of the moment, who knows? Maybe they're back in time 20, 40, 60 years. Who has to change? I'm telling you guys, it has to be us. It has to be us to accommodate this disease. if this is what's happening to their brain. So wandering trouble sleeping, it might be something like, oh, you got to go. Well, you know what? I look at my watch and I'm thinking, you know what? I could run you up there. I need just a minute though, because we haven't had any breakfast. Let me get you something to eat and we'll go up there. By the way, what do we need to take? Do you need your purse or do you need your bag or whatever? And I'm going to start working her away from the idea that she has to go up to the school and ask her to help me do something, where then I can move it away. But listen, you've heard of redirect, and we used to do reality orientation. I'm so sorry we ever did that in my career. That's wrong. If they're 40 years back and looking for their parents, then you just, oh, let me check the driveway, and you go with that. Okay, we validate it, because if we don't validate it and get on their team and accept and agree, we can't de-escalate the energy on it either. They'll stay right there with a good mad going on because in their mind, they believe it with their whole heart and soul. There's no amount of explaining that those of us who like to do the explaining, me included, there's no amount of explaining that's going to get them to understand it differently. Do you understand what I'm saying? Okay, those of you with the good brains, you need to accept and agree, validate their position. Oh, like when my mom asked if her parents were there, my goodness, guys, her parents had been dead 25 years, maybe. That's not the time to tell someone they're dead. Okay. It's not the time, because frequently they'll melt down with, what do you mean they're dead? How come I don't know? When was the funeral? All right. No, we don't do that to people. Now, there are times when they really are connecting the dots and they're just affirming. So my dad passed last month. And you might repeat that back. Oh, you're wondering if your dad passed last month, and let them clarify it for you. And if they do, then I think they're ready for that information. But let me also tell you that if you give that information and it breaks their heart and they melt down, make a mental note that we don't do that anymore. Oh, your dad? Oh, he's wherever. So anyway, my mom wanted me, I said, let me check the driveway and see if they're here. I said, that little green car. And she goes, yeah, yeah, yeah. She was worked up. I don't know what she was worried about. It wasn't my job to be the detective or the psychologist to figure out all of that. I just knew she was back in time and she had a good worry going on. My job was to come alongside and put that to bed, validate it, de-escalate it, and then redirect her. So I came back in. I said, Mama, the car's not here, but I got someone watching for him, which wasn't true. But in her mind, that helped. Okay. And I watched her go, oh, good. She said, good, 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 good. And she brought her thoughts down. And then I said, oh, Mama, I've got new pictures of the puppy. Now, guys, the puppy was probably 5 years old, but that's what brought her joy. Your loved ones, something brings them joy. We need to have notes of what brings them joy so that everyone can play the game to validate, de-escalate, and then redirect to a happy place. Whether it's talking about, the pictures of the grandbabies or, the flowers outside, the bird feeder. Everybody has different likes and dislikes. Fortunately, we're so unique and individual. But that's why I can't teach you about dementia as A plus B equals C, because we're all different. And so my likes and dislikes are going to be different. My career experience might lead my season with brain decline to be different. It's important for us to come alongside and join them on the journey wherever they are. Okay, are we getting that? So the wandering trouble sleeping thing, there is a way to redirect that, but you got to start off with the validation, the de-escalation, and then we redirect them to a happy place. Let's see here. Unable to follow a conversation. Something I've learned over the years is for you and I to pay attention to how many words they're using in conversation. If they're carrying on a good conversation, you guys can imagine I can talk, but I can talk too much. And I had to learn that the hard way, because the hand might come up with too much, it's too much. And she may just tell me to leave then. And then I blew it. So it's important to assess in every moment. Are they tracking with you in this time? It doesn't mean we go in and say, do you know what the date and time is in the year that we're talking? We don't interrogate, but you can quickly come up with whether they're tracking with you or even if they know who you are. I would always introduce myself to my mom, and I would say the first few years, she'd say, I know. But, then she'd talk about me in third person. She'd say, well, when Teresa's here, and I'm like, that's nice. I'm glad Teresa, does that. But it's just so important that we learn to come alongside and just join them on their journey wherever it is and put to bed whatever is bothering them. Okay. And so notice when you have a conversation with them, you come in, you approach from the front, and just notice how many words they're using. And I want you to use the same amount of words as they're using. So if they're using 3 or 4, hey, mom, hey, looking good. Let's go get some lunch, and then I'm going to start using my hands to signal a lot more things too. We're going to give them physical signs of what's going on. We're going to try and use all their senses, guys. We don't know how great the vision is. We really don't know how great the hearing is. And with Parkinson's, they're declining physically. And so we just need to try and communicate and come alongside using every tool that we have, okay, without upsetting or offending. There's definitely a lack of hygiene with a lot of people with dementias. Now, it's interesting that the frontotemporal ones, the people that have disease up here, it's interesting. They tend to be very proud. And they want to look good and they want they're this woman I care for. She wanted her makeup on. She didn't leave the house without her lipstick on. It was interesting. It was a blessing that she had good habits for hygiene. And if your loved one doesn't have good habits for hygiene, I would try and incorporate it now, because the sooner we have good routines as we decline with these physical and mental declines, the better you'll be. Routine helps these individuals so much. And so, whether they like to wash up in the morning, wash up at night, shower in the morning, and showers are kind of overrated. I still talk to families who are, they're determined that, mom has to shower every day. And it's like, you guys, she probably at her age, that's probably not even good for her skin at 85 to be showering every day. Okay. Probably I should just be lotioning her up every day instead of showering every day. And you can do face and hands and peri-care, the bottom part. You can do that when they use the toilet. Say, oh, let's do a quickie cleanup and, and do those parts. So if you're pushing buttons and causing problems by trying to force them to do more on their hygiene, let's hit the pause button. And you also might consider hiring someone else to come and do that part. Because guess what? I hate to tell you that for a lot of folks with dementia, the filter can really come out for the person closest to them. Okay. And so my mom was definitely hardest on my dad. And so you are going to have to bring in help, or they have to go live somewhere else at some point. Otherwise, it can really take the caregiver down. And so I know that lots of families that I've worked with, they'll say, well, she's not going to let anybody come in. Whenever I mention someone coming in, she says, no, drop dead over my dead body. And they can use the emergency words, which are frequently ugly. Okay. Don't react. Hit the pause button and realize if there is emergency words, pain, fear, anxiety, see if you can be a great detective. So what we usually do is, well, for my mom, we got off easy because we told her we needed to bring caregivers in because dad was so much older than her. Not that much older, but she goes, oh yeah. Oh yeah. And she went with it. And so we got off so easy in saying it was for him. But there are other people that we tell them, Medicare is requiring it now for anybody over, she's 84, so I would say anybody over 83, Medicare is requiring that you have caregiver twice a week now. And you are on their team with that. Can I tell you that I want you to have the relationship has got to be the most important part with this person. So don't do anything to put cracks or damage into that. No finger wagging, no reminding. If you need a vent partner, get one outside of this relationship. But the relationship's got to be so important, especially with people living with dementias. And so when they're forgetful, like think of if you're talking about Alzheimer's, um, occasionally we would make up a little white lie like that. But I'm on her team the whole time with, I know, can you believe this? What else is the government going to tell us? And I would just be right there with her, frustrated and coming up. So I'm validating and that she's upset about that she has to do it. And then I'm going to de-escalate it by saying, well, we'll check this person out. You know what? Let's go ahead and make a list of what we need them to do. And also key point. Don't tell them when they're coming. Don't tell them when they're coming. Okay. Let them just show up. Why? Because there's an element of idle chit chat on the right side. It's like when you take people that have brain failures to the doctor, they tend to be able to sit up a little better and communicate a little better. And you're like, who is this person? This isn't how you are at home with me. But the ability to be cordial is a tool on the right side of the brain. And people that develop dementias, they use it because it's frequently hi, good, you, me too, yeah, good, yeah. Oh, I don't know. Yeah, good, yeah. Is it time to go? Okay, good. And it's just idle chit chat. And so with the doctor, it's sometimes very difficult for the doctor to get information. And I hate to tell you, but that is a time, if your doctor's not aware, that we can really damage that relationship with your loved one. I'm going to write down the problems that are going on. If my person doesn't see their disease, if they're in the disease and they're working with you and they want the information, and with Parkinson's, that's usually the case, especially early on. But once dementia sits in and then maybe they don't see their disease anymore, like my mom, get out of my blankety blank house, you know, then maybe I want to write down their issues and hand it to the receptionist when we go to that visit. And in front of the doctor, on that paper, it says, Bob's doing this, 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 this. Hey, by the way, please don't ask me any questions that goes against what he's telling you because I'm going to have to agree with him because my relationship with him is the most important thing I've got going. Because I know a lot of rides home after seeing the doctor that have been really difficult. And the doctor's just trying to gather information. Well, what if you gave it to him or her, written out with a number down there or an email or something that you can communicate with them on a different basis? And I've had people say, well, I'm not the power of attorney. I can't, how do I give information? Guess what? You can always give information. They don't have to give you information, but you can always supply information. Trust me, your medical people, they love more information if you have it because the person living with brain failure, they're not always good historians. What do we say the first symptom usually is? That's right, memory loss, you know? And so you'll have that. Does that make sense to you? So I just wanted just a little coaching on your doctor visits. Make sure you're on that person's team. You guys are connected at the waist. Make the relationship the most important thing you have. If it's a bad day and he doesn't want to shower, meh, you know what? I don't feel like showering today either. Let's go get some popcorn. And who cares? All right. We can't be so hell bent on the schedule that we ruin the relationship. All right. And I know I've had fixer daughters that have absolutely ruined the relationship with their mama because it's mom, we got to do this. Mom, why can't you do that? Mom, why don't you remember this? Mom, you haven't showered in a week. Mom. That mom was struggling with some pain issues that the daughter couldn't see. I don't know about you, but you just can't live well with pain. She had 10 ingrown toenails. She had a lot of pain, but she had no brain capacity to say it out loud or to tell her. And so she didn't feel like doing anything the daughter wanted her to do. But the daughter poked and poked and poked so many times that she didn't want the daughter in her presence anymore. And she would just put her hand up and say, no, 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 because she'd ruined the relationship. So, guys, side note, the relationship's the most important thing you have with this person. You have to love them along, and you either have to bring in help to save that, or they'll need to go to a community and then your relationship changes. I needed to figure out how to still be the daughter and not be the nurse all the time in my mom's relationship. Okay. But I needed to be on her team all the time, even when she was forgetful or, was looking for her parents. All right. Okay. And there's more symptoms. The symptoms list goes on and on and on and on and on. The symptoms list, dementia is an umbrella. It's not a diagnosis. Now, sometimes people end up with that as a diagnosis because maybe they're too afraid to do testing and then we're stuck. If they can't go on with further testing, my mom was at a point she wouldn't leave the house. And we ended up having to have nurse practitioner come to the house for a few years and then eventually hospice come to the house for a few years. And that's the way we progressed with it. But dementia is a collection of symptoms. Think about all those symptoms we talked about being in the top blue part of that umbrella. This is a Teepa Snow slide, by the way. I want to give her credit. She's awesome. But she came up with this. And the teardrops underneath are the diagnosis. So the biggest one, of course, still is Alzheimer's, but there's frontotemporal Lewy body, and that's definitely Parkinson's related. We're learning more about that and the vascular dementias. And then the list is, like I said, more than 120 diagnoses we've figured out. But it's so important to know, is this a real dementia or is it a urinary tract infection? Listen, when I worked in the ER at UC, half of the live squads that brought us somebody what they thought was having a stroke or some type of brain accident turned out to be a urinary tract infection. Half. It was one of the first tests we did was check the urine, all right, and see if they had a UTI. It's just very common in women, very common in women, those of us that are over 60. So especially if we start getting them, boy, we could keep getting them. So let's look at that. But that's not a dementia. It can complicate your dementia, but it's not a dementia. TIPA says a true dementia means two parts of your brain are dying. Okay. Nothing stops it or cures it. It keeps progressing or changing and it's always terminal. Well, yeah, but so is life, right? We're none of us are going to get out of here alive. And so I don't want you to get depressed about whatever, ailment has come down. Let's make the best of this. Let's learn how to make the best of it. And let's learn to be part of the solution, guys, and not part of the problem. When it comes, these bodies are going to decline. And so we take care of them the best we can, but we also need to be coming alongside and doing the best we can with what hand we've been dealt, so to speak. All right. Eating right, exercising, keep moving. With Parkinson's, it's move it or lose it. You know how that works. And so, but they keep learning new things about brain changes that happen and how you can create new pathways in the brain to figure out how to walk again. It might be a little different, but how cool is that? So just stay in the game as long as we can. Let's focus on normal and not normal visual change just for a second. And I want you to understand peripheral vision. This is one of the first things, well, not maybe one of the first things, but this is something I think if you don't understand it, you can upset a person really bad if you don't understand peripheral vision loss. What's that? So it's like when you stand and you're looking straight forward and you got your hands straight out to each side. Y'all can do this in the privacy of your homes. I'm not looking at you. And wiggle your fingers on each side. And can you see those fingers? See, I can't anymore. What? When I was 25, I could see both hands at the same time. Peripheral vision. It's how I can see. I could see at least, 180 degrees. It was wild. But now, if I'm honest, if to see both hands at the same time wiggling, it's probably 50%. And you're thinking, uh-oh, is that bad? Can I tell you it's normal aging that we lose peripheral vision? That's why it gets harder and harder to check your blind spots when you're driving. Normal aging. But we find that with most dementias, they lose peripheral vision to the point of a scuba mask. Okay, now put your scuba mask on. Put that scuba mask on and tell me what you can see in that room where you are. Put them on. There you go. Okay. Do you see, if a person was sitting next to you, would you see that with scuba mask? Nope. Would you see your food down on the table? Nope. Do you sometimes see the guy across the way, his food? I'm going to reach over there and get your chicken nuggets, right? I can see those. All right. The other thing is we can't come in from the side and startle people. Startle people. Don't come up from behind. And don't let the grandkids do that either. Okay. Don't startle people that have brain failures. It's not a good idea. And the dukes can come up. Why? Well, the limbic system in the brain, that fight, freeze, that seems to stay very active in these brain failures. Why? I don't know. I'm not God. I don't know. All I can tell you is it seems very active. And if you startle them, the dukes can come up. Think about it. Their vision's challenged a lot of times, right? Their hearing is challenged a lot of times. And so, but yet in that broken brain is that ability to still protect themselves, right? And if a threat is there, the dukes might come up and they may hit. And that's why TIPA teaches us that we only approach people from the front. All right. We got to get permission to enter their personal space. Now, I know if this is your loved one, that just your voice in the room, I'm sure lets them know you're there. I still would be careful about coming up from behind, from the side, and startling. I still would be careful. But for someone you don't know, if you're someone who cares for someone else, or if you're visiting people in a community or at someone's home, you need to approach from the front. And TIPA tells us to stop 6 feet out, my arm's length, your arm's length. And I'm going to greet you. Hey, mama, it's Teresa, the nurse. And I also put my hand out. Why do you think I do that? Now we put a hand up because if they are paranoid and suspicious, I want them to see that I don't have any, handcuffs or ball bats or needles or anything. Okay. And I put my hand out like this because what does that make you think of doing when I put my hand out to you? Yep. Most of you are going to take my hand. Did you think that up? Did your brain say, I think she wants to touch my hand? No. Muscle memory says that's what we've been doing all our life. That's how we greet people, except during COVID. All right. But yes, that's how we greet people. And so for people with brain changes, it is a great way to get into their personal space and for them to give you permission to touch them without me worrying about coming in too fast or startling. Now, I can tell you, you need to give it a minute or more. When I went to visit the lady who had the ingrown toenails, because the family just said, "She mean it's a snake. We can't do anything with her." When she greeted me at the door, um, I did that. I approached from the front, put my hand out, and I just waited. I waited about a minute and a half before I said anything or did anything. And you could watch her checking me out to see, if I was friend or foe. But her limbic system was ready to, she'd already been kind of aggressive. She was right here because they'd been correcting her for a long time. You can find your loved one in this state all the time because someone keeps telling them what to do. How about we love them in some way? How about we compliment them? How about we thank them for being our spouse or our mom or whoever? How about we turn it around? And as soon as we greet them, Tipa says, not only do we wait until we get permission to come in and touch them, but taking their hand and coming forward and then getting out of their field of vision. So if I've got scuba mask vision, which will progress to a binocular and then a monocular, but if I've got this kind of vision and you're standing directly in front of me, well, that's kind of very confrontational because you're taking up all my space. All right. So I can't see a way out. And that could make me not relax around you. So normally I step out of the front of them. I've got their hand and I'm paying them a compliment. What did I say? Pay him a compliment. Now, I know you just came in and the house is a disaster because obviously mom was looking for something last night and you had that house spick and span and now it's a disaster. And the first thing you want to say is, "Good Lord, mom, what happened here? Looks like a tornado came through." Okay, wrong answer. You start the conversation on that, right? It only takes a while until you damage that relationship where then they're not going to listen to anything you have to say. They may even act like they're sleeping. Okay. They'll shut down. They'll shut down. I'm just telling you the relationship's the most important thing. I just want to give Teepa credit because she's amazing. She's internationally known now. Okay. So that technique I just taught you was called positive physical approach, and that's Teepa. Okay. So if we approach from the front, everything's hunky dory, right? Well, not always. Okay. It's helpful to notice if the person living with dementia, do they have awareness of their condition? This is very important. What does that mean? Like some of you might know someone who has some type of brain failure. Maybe it's been diagnosed, maybe not, but they think it's all your fault. What? Yes. Like my mama kicking me out of the blankety blank house. It's like, what just happened? And she seemed to have no awareness. Like you'd come in and want to help her to the bathroom, and she would say, "Excuse me, I do that myself." I'm like, whoa, you haven't done that yourself in like 3 years. Honestly, we were so dumbfounded by this. And it makes the logical side of my brain want to say, "No, you haven't. Now quit acting like that." And then she'd get more aggressive. I'm just poking, next thing I know, she's got the emergency words going and I'm getting kicked out of the blankety blank house. Did anybody win? No. So we need to have awareness about whether these folks know they're struggling with a dementia or not. So this is the big point I want you to take away today. Anosognosia. When I spent all that money to go spend time with Teepa, this was the most important thing I learned. Anosognosia. I don't know why I hadn't studied this. So it's the inability, it's a diagnosis. It's the inability to see the brain deficit. So what's that mean? So for someone who has bipolar disorder, maybe let's use that as an example. Do you know someone with bipolar disorder? Like, isn't it amazing that sometimes they'll start taking their medicine and they start doing better? Everybody's different, but a lot of them start doing better. And then what happens? They stop taking their medicine. You know somebody like that too. So do I. And I'm thinking, why? Not smart. Don't do that. What are you doing? What are you thinking? Because then their life is, it's really tough unless they have someone, propping them up to take their medicine. Anosognosia, the inability to see the brain deficit. So it's not just they aren't being bright, they honestly can't see it. So we see it with bipolar, we see it with schizophrenia, we see it with probably 50% of the people that develop dementias, documented, brain failures. Okay. So it impairs the person's ability to understand or perceive his or her illness. So my mom really didn't know she was sick, legitimately. And no amount of explaining, as I call it, because boy, we tried to explain for a lot of years and only got us kicked out of the house. No amount of explaining would ever let her be able to have that perception. Wow. Okay. So how do we come again? How do we work with this? Well, guys, it's a brand new care plan. And all I can tell you is you need to validate, and then you have to de-escalate, and then you need to ask them to come help you do something. I mean, here's just an example with my mom. Let me just go back for a hot second. With my mom and the anosognosia thing, one of the hardest things were getting her, help her to the bathroom. I told you she didn't walk. She was in a wheelchair. And of course, in that old house, the wheelchair was too big to fit in the bathroom. You knew that, right? So we had to have the bedside commode in the bedroom, and we put it in front of her dresser. And we had all kinds of boxes of fun jewelry for her to get into later in the disease in front of her. So we pull that drawer out. She had all kinds of good things to get into. We had a bird feeder up in the window, and you basically would get her back there and then have a conversation. And it was just, as long as you didn't make a big deal about embarrassing her, it was just fine for you to be there while she did her thing. Um, but it was really tough in the beginning because the caregiver would call and say, we can't get her to go to the bathroom. We've asked and asked, and she keeps telling us she does it herself. And so we had to learn how to come up with a new care plan. And I used this for years with my mom. Your technique will be different, but that's okay. You have to come up with whatever works for your situation. I told you they're all different. So I would come in, Mama, hey, so great to see you. And I would usually be an evening person. She was more tired and she was having more trouble. And so I would sit and visit first. Don't just come in. I think caregivers make this mistake in communities or in hospitals. They come in, just dive into the task, and they forget the relationship. It'd be better to even sit down, have a little conversation. So I'd say, hey, Mommy, looking good. And she'd say, thanks. I'm like, love those glasses. Same glasses she always had. Okay. So it didn't matter, but it brought her joy. And you find out what brings them joy, but you have to note to self. Mayo Clinic says your tone and body language better go along with what's coming out of your mouth. Because I get some caregivers that are tired, rightfully so. They're always understaffed. And they're like, yeah, Martha, your hair looks nice today. Okay, because they're tired and they're tired of giving compliments, right? So all I can say is your tone and body language better agree when you're coming in. And I would say, and then after a few minutes of conversation, I would point to my shoes and I'd say, aren't these shoes cute? Didn't matter what I was wearing. I'm not a shoe hound or anything, honestly. I'm not. And might even be boots. Aren't these cute? And she'd say, uh-huh. And I'd say, oh, but I got a blister, Mama. I got a blister and I really need a Band-Aid. And I think they're in your bathroom. I can't find them. Could you help me? And I'm telling you what, you ask people with anosognosia, the ones who think they're always right, never wrong, always the victim, it's always your fault, by golly, and they can't see their disease. You ask them to help you do something. Well, listen, they think they're the smartest one in the room anyway. So go with it. Go with it. It's about the relationship. But what I want you to understand, and she would come with me. And on the way back, I'm skipping because I'm not having to drag her back there kicking and screaming, which had been done by some people in the past. We're just having a conversation. We start talking about the grandbabies and puppies and kittens, whatever brings her joy. And then we had a routine though. You push up next to that bedside commode, put the belt on, 1, 2, 3, up we go, britches down, sit down, and we carry on the conversation. All right. We don't make a huge deal out of toileting or whatever. But honestly, guys, if the toileting is like out of your wheelhouse, then okay, let's get people in to do that, or it's time to go to a community. I'm not judging anybody about that. I'm an old nurse. I can change your britches. Okay. I can give you a bed bath. Done a million times. We can do that singing Christmas songs. It doesn't bother me at all. Okay. It's just in my wheelhouse, but I know it's not for everybody. It's okay. So have on your radar every time you come into their presence to assess where they are emotionally and in their lifetime. Have on your radar. So when I came in that time and she's like, "Are my parents here?" Okay. So she's back in time. She probably doesn't even know who I am. It isn't the time for me to straighten her out on anything. That's your time to be part of the solution and not part of the problem. Oh, and I didn't really know what I was going to say next. They surprise you, don't they? And they say things off the wall, and you're like, "Oh." And so I said, "Well, Mama, let me just check the driveway." And I left the room because honestly, it gave me a minute to think about what in the heck I was going to say next. Okay. And that's when I came back and I said, "Hey, I checked the driveway and I got someone watching." "Oh, good, good, good." And then I redirected her to a happy place. It was over in less than 2 minutes. Right? Instead of me saying, "Your parents have been dead for 25 years. What are you thinking? Hey, aren't these puppy pictures cute? Do you think that would have worked?" Everybody say, "No way." And you would have been kicked out of the house. Yeah, with her emergency words too. I can guarantee about that. So, a couple tools for you, and then we'll wrap up. Susan McCulley is a colleague of mine up in Canada. She came up with something called the bangs technique. And there are lots of techniques, but I like to give you something simple. BANGS. Okay. And I'll put this in the notes for you. So, we practice the bangs. The B is to breathe. Breathe and keep in mind who has memory failure and who doesn't. But you got to take care of you. Listen, primary caregivers frequently die first. I'm not all the time, but it can happen. If you don't bring help in or you don't get some good techniques to take care of yourself, guys, it can take us down. We'll get sick, we'll have a heart attack, we'll quit, we'll just start ordering pizza, we'll quit going to our place of worship, whatever. It can really take us down. You got to be able to take care of you if you think you're going to take good care of somebody else. Know your plan B. I already told you that. So take a breath before you even walk in the door and let your problems out. Listen, you can't go in there and unload problems of the day on this poor sitting target. Okay. It's not fair. It's not right. What are we supposed to do? Bring them joy. Oh, bring them joy. So think about a compliment. And honestly, if they don't have any short term memory, use that same compliment over and over again. If they love it and it makes them smile, my gosh, use it over and over. I think it's fine. The A in bangs is to accept and agree. We're going to accept and agree. Oh, oh yeah. So you need to go home today. Okay. Now she was home. All right. But it wasn't. And I said, "Do you need to get something there or you just want to go there?" And I might ask them an either or question. Now you should write that down. Stop asking yes, no questions with people that have brain failures. Stop asking yes, no questions. Because what do they eventually learn to say? No, no. Do you want to eat breakfast? Do you want to shower? No. Do you want to eat lunch? No. Do you want to take your medicine? No. Okay. So hit the brakes, pause. Let's redirect. We're going to start using either ors. Hey, did you want bacon and eggs or did you want that French toast? Oh, okay, good. I wanted that too. Good. And then compliment it, tell them it's what you wanted and move forward. Were you going to take a bath or a shower today? Were you going to shower or just wash up today? You know what? Either one of those is okay. We don't have to shower every day. But if you give them an either or, who feels like they're in control? This is for the people that have anosognosia. This is for the percentage of your people that have brain failures that can't see the disease. They're the ones who think they're going to go shopping. They're the ones who think they're going to go on a trip. They want to go on a cruise. They're the ones that think, they're going to go do all these amazing things. And you're thinking, that's probably not going to happen. So we better know how to validate that, come alongside and redirect it. And then you're going to have to ask for their help. So accept and agree, no matter what they're talking about. If they think it's June right now, well, it's a sunny day, isn't it? I love these sunny summer days. I love that. Hey, I was thinking, did you want, some orange juice or did you want, whatever, grapefruit juice? Okay. Never, never, never correct and argue with them. What did I say? That's right. I don't want you to correct them. Accept and agree. Accept and agree, guys. Correcting frequently gets their back up against the wall and can get you kicked out of the house. There's no logic. What did I say? Yeah. If you realize your person doesn't have logic, let it go. Let it go. Don't worry about it anymore. It's done. You got to let that go. Okay. Along with if they come up against you and get mad at you and maybe, you know, call you everything except what you are and kick you out of the blankety blank house like it happened to me. I needed to get over that and realize that's a disease talking. And who made the mistake? Yep, I did. I had corrected her and didn't realize that that was not the right choice for someone who has anosognosia. I hadn't heard of anosognosia. Okay, last thing, say you're sorry. Say you are sorry. Sorry is the best diffuser of their agitation. If you guys are struggling in caring for somebody, it is time to bring help in, or they need to go to a community. I know those are very, very, very hard choices. And I know, you know, Maureen and those guys probably have great suggestions on where to go and what to do. But I'm just saying, start making plans because you're going to be no help to them if this takes you down in the process. Okay. So say you're sorry. I'm sorry that happened. Or you know what? One time I went to go into changer and I came in way too fast. I'm like, Mama, let's go. But she's like, shut up and sit down, Teresa. Who made that mistake? I did. Absolutely. Who said they're sorry? I did immediately because it's so important for me to save the relationship. Listen, guys, we're going to mess up. And they're going to get upset. And it's not if, it's when. This is brain failure. And they can be having, I know there was a time the girls called, my mom was in a lot of pain. Well, she was hollering her emergency words, GD this and GD that and GD this. And I'm thinking, well, you guys, you got to be a great detective, not a judge, because they wanted to give her something. Hold it, hold it. Yep. I'm like, could we investigate what it is before we give something? Because how do we know what to give if we don't know what's wrong? Turned out that when they were pushing her back to her bedroom, bumped her elbow on a door frame. Nice big skin tear. That flannel nightgown was just settling right down into that. But what is it when then they don't have the words to say what's going on? And all they're using are the emergency words. You hear emergency words, pain, fear, anxiety. I'm going to hit the pause button and see what I can do to investigate that and see if I can come alongside. Because throwing an antipsychotic at that, I don't think that's right. I don't think it's fair. And it certainly isn't my first line of defense in this business at this time. So you guys have been so great. We're going to review and do a few questions. Let's approach from the front. Let's get permission to enter their personal space. Let's make a positive connection. That means give a compliment. Say you're sorry at the first time of agitation. And then remember, it's all about the relationship. Can you see the dementia? No, not always. But now you got the tools to join them on the journey, guys, and be part of the solution, not part of the problem. All right. They're doing the best they can with what they have left. This will all be in your notes. And we're going to go to questions. Sorry, ran long. Typical.
All good. Everyone, feel free to unmute themselves if you have questions for Teresa.
Teresa, I think it's hard for our patients to determine what brings them joy.
Es-
That when they just can't identify it.
Especially if they can't express it either.
Right.
Because your patients can't always express that there's something bringing them joy. That is tough. And so it is awesome if we at least have a history with them of what did bring them joy. And we start there of what did bring them joy. But frequently, things that help in the situation might be less activity in a room. Maybe we need to calm down the room. Maybe we need to have a music playing that is soothing to them. Maybe we need to think about the schedule, and maybe we don't ask them if they're hungry. Maybe we just put a snack in front of them and see if they go for it without having to answer anything. So I would say there are techniques. Think about your relationship with this person and what you've done in the past to bring them joy and what makes them happy. Is it the flowers? Is it a fresh picked flower? Maybe it's just, that daffodil you bring in and that brings them joy. Some people, it's very simple. But for a lot of us, it is reducing the noise, reducing sometimes the TV becomes an agitation. I hate to say. I know a lot of folks use that as kind of like a babysitter sometimes, but and so it is hard when you can't always express that you're happy. And you know what else I think is hard, Maureen, is that frequently those of us who are very expressive and I want to see that I'm bringing you joy, right?
Mhm.
But what if that person really doesn't want to interact anymore and they've gone to a place where they need this space? What if they're there? You know, we need to respect that too.
And how do you deal with apathy? I'm sorry if anybody else has questions, but I need all this help.
Yeah, and I think we always review medications. Maureen, I know you're so good at that, reviewing the medications, because I think sometimes I find out, they're on, several antipsychotics or sedation type things, and then it's no wonder then that they just want to sleep all the time. We do see people with brain decline want to sleep more too. And we do see some that just want to give up. I wish there was a magic wand that, would just, I could tap it to you and you would bring this
Absolutely.
back. But it
Mhm.
can be, it is sad. And it can be, maybe you find out that bringing the one grandchild in is something that makes them happier. Maybe it is the football game. I tell you, we really got to be great detectives. And I want you to write down the things that bring agitation and write down the things that bring them joy. Even if it wasn't something you did, maybe one of the kids came in and dad seemed happier and more relaxed, and so, oh my goodness, we're putting him on the schedule. He needs to stop by more. And maybe if that brings him joy, or maybe going through the last trip you went on, maybe that brings him joy. It is, we just got to be great detectives, Maureen, and figure it out. Every one of your every one of your loved ones out there are different. And you guys have different lifestyles and different cultures and different experiences and different work experiences. There was a gentleman that I had, he'd been an executive. And so this being home all the time, he really felt he needed to be at the office. And so, you know what? The family hired someone. It was a guy as a caregiver, but we had him dressed in professional attire and carried a notebook. And so he was there, and he didn't change this man or do any care for the first 2 weeks. He just built relationship. And he said, Mr. Smith here, I'm here to take care of your needs. I'm your new assistant. I hope I can live up to this job. I know you're an amazing executive with whatever. And they just played along with him. And every time he got worked up about something and started wanting to dig through drawers or something, they were able to say, thank you, sir. I wrote that down. I'll take care of that for you, sir. Thank you so much. And they could learn to put things to bed. But your situation is going to be different. I think for Parkinson's that's less activity, less getting into drawers and stuff. But the other thing you need to remember, if they develop a dementia, they're not going to remember the assistive devices that they need. Like once they need a walker or a cane or something, just know that if the short term is gone, it's gone, and you can't teach them new tricks. And even if the doctor says, well, Bill needs a walker now, well, guess what? Bill's not going to remember that. So whose fault is it Bill didn't pick up his walker? Everyone say mine. So I would say, Dad, my goodness, I forgot that Dr. Joe wants you to have your walker now. I'm sorry. I know it's a pain in the neck, but he wants you to use this all the time now. And then he'll do it. But if you said, Dad, I keep telling you, you're supposed to use that walker. Dr. Joe said so. We got to do it. Okay. Yeah. Is that helping the relationship? Everybody say no. Okay. So part of the solution or part of the problem every day. And, would you say, Maureen, that many of of the folks that come see you have some form of dementia, or is it about 50%? What I'm seeing, what are you seeing where you are?
Well, I wouldn't say they've reached dementia. They
Oh,
certainly have cognitive impairment.
okay. Cognitive
Okay.
impairment. Okay.
So, and it's mostly for people with Parkinson's disease, it's mostly frontal executive function,
Okay.
right?
Okay.
But that certainly contributes to short-term memory, because if you can't focus, then you can't get it into your memory and you can't pull it back out. So
Yeah. And sometimes that frontotemporal, they lose the filter between their brain and their mouth. Have you seen that? Anybody?
sometimes,
Sometimes.
yeah.
Okay. I've just seen it a little bit where uh, honestly, there's a percentage of people that develop frontotemporal that lose that filter and they end up divorced. They end up in divorce court in front of a judge before they see the neurologist, because nobody has put together what these symptoms are with him being aggressive and calling names, and just seems like there's no filter. Like if someone walks by and that outfit isn't too becoming, you and I would be able to discern that we don't look and stare, and we don't say anything like a little tight there, babe, right? Okay, so we would know not to say that. But I can tell you that I've been with people who the filter is out and they were frontotemporal and they would just say a little tight there, honey, a little tight. Like we don't need to see all that information. Okay. So So all I can say is we have to position them to win then. So maybe we don't take them places where there's lots of steps. Maybe we don't take them places where there's lots of people, or maybe we position them at the restaurant where they're just facing you in the corner. So there's not all that extra stim. We also have to pay attention to the music being played in a restaurant. My gosh, I was at a place the other day and my dad just wanted to leave. It was so too much. And so, but you can make that mistake in the house too. Questions? Who's got a question out there? Did I fill you up too much?
Perfect.
I have a question as a caregiver.
Yes.
How do you help a family who kind of wants to look the other way? And this may be a huge can of worms, but that want to look the other way and don't want to acknowledge what I'm seeing and
See it
what's
all the
being
time.
exhibited.
Yeah. And so the whole denial thing, it can be a real thing.
Yes.
And it's even more challenging when these people are closest to the person, because the changes they're seeing are very slow. And like we come in, when I'm most busy, Maureen, this might happen for you too. I'll be so busy in January. Why? Because all the kids are coming home for the holiday. And they're
Right.
going to see the big problems that have happened, but dad hasn't been telling them mom's acting like this, or their tremors are really bad, or she's, stumbling around. Because for him, it's just been what they've been doing. He's been walking her to the bathroom like this, for a long time. So you're so right. Sometimes they're too close to it and they can't see it, or they are in denial. And so what we typically do, there have been times when I'll just do a Zoom call or an in-person meeting with the siblings who get it, who aren't sure how to approach dad. Because dad, as soon as they bring it up, say, don't start with me. She's fine. Don't you start with me. Okay. So then there are times then where I then go meet with him privately or on Zoom. Now, frequently we get the whole family on a Zoom call, and I make sure everybody gets to say their piece. And then we explain these techniques to the whole family at the same time and try and lead them all in the same direction. Because even in my own family, my one sister who lives in Maine, when she would come home, she'd be like, what are you guys doing to her? She looks terrible. What are you doing to her? And I love that sister so much, but it's because she would come home every 6 months. And she would talk to her on the phone. And what did I tell you about that idle chit chat and the ability to be cordial? My mom would say, oh, yes, good, fine. Oh, fun. Everybody's fine. And you see, then she'd say, I don't know what you guys are seeing. She's great with me. She's great with me. And it's like, and she'd come to town, and my mom was getting more and more drawn. She wasn't quite as pretty as that picture I showed you, more and more drawn, and she didn't really she didn't want to get her hair done anymore. So, you might have a ponytail or just a headband or something. And, but that's hard. But so frequently getting the whole family around a kitchen table or on a Zoom call, is the best thing, because you got to get everybody on the same page. And a third party is sometimes really helpful to get everybody the ability to say their piece. Well, Maureen, it's been such a pleasure to be here. And anything else I can do to help? My company's A Better Approach to Memory Care. We try and put a podcast out every week, Memory Care with Teresa. It's on YouTube, Spotify, and it's on the website, teresayoungstrom.com, because the folks my age and above, we don't want to go searching the internet for things. We want it in a simple place. So we put it on the website where you can find it, teresayoungstrom.com. And so it's just been a pleasure being here. If there's anything else I can do to help your organization, I'm in.
Thank you.
Teresa,
Teresa.
thank you so much. We really appreciated this.
Very good.
We'll be in
Thank you.
touch.
I will be in
Excellent.
touch for sure. Thanks,
Yes.
everybody. I'll send the
Excellent.
notes.
Thank you
Happy
very much.
Thanksgiving.